So they didn't put the word metro when they told you nucleic acid synthesis. By eliminating every answer choice as you're studying and prepping, it forces us to review, to strengthen our foundation, and to focus on what you don't know or you don't know that well. Because metro is very familiar, but you know the MOA? Maybe you don't know, right? So now we have two, transpeptidase and aminoacyl tRNA. tRNA triggers the word to me, tetracycline. So I know this is a tetracycline, this is out, this is the answer, boom. Maybe I forgot that penicillin G or penicillin it inhibits the bacterial cell wall. Maybe I forgot it deals with transpeptidases. Maybe I forgot. We're all human, right? But penicillin G inhibits the synthesis of the cell wall by mimicking diala structure, because vancos diala of the peptidoglycan residues. This, as a beta-lactam antibiotic, penicillin G binds to transpeptidase and inhibits, this is PCP, by the way, PCP, also PBP, penicillin binding, PBP, and inhibits cross-linking of peptidoglycan. This information here is more than enough for you to know. The problem is, do you know it? The problem is, can you retain it and recall it on exam day? And I promise you, this is more than enough that you need to know about penicillin G. So you needed to know it's syphilis. Then you need to know syphilis, I can give penicillin. But let's say you didn't know about penicillin being as the answer choice. You knew the other ones. You knew that this is floral, this can't be it. This is metro, I don't give metro for syphilis, this is out. This sulfa is trimethoprim, sulfamethoxazole, these are both out. So by default, you're down to 250-50. So from having less than 20% chance of getting it right, now it's 50-50. That's how you build your stamina to say, well, I hit the tip now. Tip says penicillin. I'm not exactly sure which one's which. Open the book up, learn it. Or as you get better and better, you say, well, now I know that tRNA is tetra, and this is the answer is penicillin. And then you go to the other ones and review. Because look, 10% went to this one, but this is tetracyclines, prevent 30S subunit by binding. It prevents the binding of amino acid tRNA. So you see, even if we know the buy at 30, sell at 50, which we did before, we did it. Here we go, ready? Buy at 30, sell at 50 right here. Buy at 30, sell at 50. But we also see initiated tRNA, 30S. We have to make sure that we know as much as possible. So when I ask you guys, please review, please understand when something comes on your radar, you should go back, review it one more time and say, I know the buy at 30, sell at 50. Can I learn something newer that I didn't know before? And what you know now is, besides the buy at 30, sell at 50, that the tetras prevent binding of amino acid tRNA. And it was right in front of you to begin with. The tRNA is right here. This is 30S. Obviously, this joins together to go into this level here. This is a little too much. I wouldn't focus heavily on this. I would just know the different categories. Clearly, they'll ask you so many questions on adverse effects that if you can't tell me which ones are which, that's step one, meaning level one of your studying. Then you go into knowing adverse effects. Then you come back and you put more layers in your foundation. Say, okay, well, tetras, usually they have issues of binding this. And then now, if you read it further, tetras have activity against Borrelia burgdorferi, Mycoplasma pneumoniae, Treponema pallidum, brucella, and so on. Doxycycline can be used to treat syphilis, but is typically reserved for patients with allergies to penicillin. Wow. So the more you review, the more you add layers to your foundation, the better you become.